All right, welcome back. We left off chatting about prophy paste, how it comes in different grits, and some of the contents that are incorporated into that paste to do the job that we need it to do. The next one we're going to talk about is dentifrice or toothpaste. Over-the-counter toothpaste contains 20% to up to 40% abrasive agents, along with coloring agents, flavoring, and other therapeutic agents such as fluorides. The abrasive agents in toothpaste improves the efficiency of the ability of the toothbrush to remove stains, food debris, and biofilm or plaque. The lowest possible abrasive rankings are desirable to prevent removal of the softer tooth structures and restorations. The American Dental Association seal of approval indicates that the abrasive particles do not exceed the maximum acceptable abrasiveness and that the scientific data verifies the claims made by the manufacturer. So when you are choosing your toothpaste, make sure you're looking for that seal of approval from the ADA and recommend that your patients do that as well. The benefits of using ADA toothpaste is to assist in the reduction of biofilm, plaque, stains, caries, and hypersensitivity of the dentin. This also can assist in the remineralization of tooth structures and to assist in the reduction of calculus formation. It's not going to ever reduce the amount of calculus that has already formed. So if you're using a tartar control toothpaste, that helps to reduce the amount of new calculus to form, but it will not remove calculus that has already been accumulated on the teeth. When choosing a toothpaste, consider that abrasiveness, the frequency of how many times a day you are going to be brushing your teeth, and how long, and the technique that is being used, as well as all of those things being in mind when recommending toothpaste for your patients. Because the highly abrasive and acidic toothpaste, when used over a period of time, can cause gingival irritation and excessive wear on the enamel, especially if the patient is using an improper brushing technique with a firm bristled toothbrush. And this figure shows just that. This shows toothbrush abrasion. It says, notice that the effects of the abrasion are not only seen on the teeth, but also on the amalgam. So on this tooth here, we have the amalgam. It is kind of worn away all the areas around that, and it has dipped underneath the level of that amalgam filling for the patient. Denture cleansers should be mild cleansing agents recommended for the patients. Denture cleansers are mild cleansing agents to remove plaque and stain from the surface of the acrylic dentures. They can be commercial cleansers, but they need to be non-toxic, non-abrasive, and harmless to the components of the prosthesis. The patient can use a toothbrush, water, and a mild cleansing agent to clean those dentures. A lot of times I would just recommend my patients use their denture brush, which is a little firmer bristle brush, and warm water and liquid hand soap to clean their denture. And then if they wanted to spiff it up once a week or every other week, they could use those tablets that effervesce in the water, or another type of cleanser to really get the denture or partial feeling nice and smooth. Other types of materials used in abrasion are diamonds. Diamonds are the hardest substance known on Earth. They will efficiently abrade any substance. Diamonds are, though, expensive and usually not disposable. Diamond burrs are one of the most expensive burrs that we can purchase for the handpieces. Several of these brands are sterilizable and can be reused several times before they wear out. They are used to cut crown and bridge preps and to finish and polish composite restorations when the grit is more fine. There are a such thing as single-use diamonds that are becoming more popular so that the doctor is ensured of a sharp, very effective burr to be used throughout the whole procedure. Carbide finishing burrs are made of tungsten carbide, and they come in several shapes. The higher the number, the finer the finish they will provide. These burrs are used to cut preparations or to finish composite restorations. The design of the burr or of the blade on the burr affects the rate of the cutting of that instrument. For carbide finishing burrs, if the cutting rotation per minute is unchanged, the greater the pressure exerted on the surface equals a greater rate of removal of the tooth structure. So typically the doctor will say, let the handpiece do the work, don't be pressing on the burr while it is rotating. And the same goes for your Profi cup. But when we're talking about carbide finishing burrs, the requirement for a burr, which are set by the ADA, takes into account its durability, concentricity, so how well it spins in a 360-degree circle, the neck strength of the burr, and the dimensions of various types of burrs are all set by the American Dental Association. A silicon carbide is added to discs and rotary instruments, which are used primarily in the finishing procedures of restorations. Aluminum oxide is a white or tan powder, which is used in sandblasting techniques. It can be impregnated onto rubber wheels, more commonly known as Burlue wheels. They are used to smooth enamel or to also finish metal alloys and ceramics. If these are used intraorally, they need to have a water cooling agent mixed onto them so that they don't create too much friction and irritate the pulp. Sand can be manufactured and coated onto discs and handheld strips in the finishing process. We know of these as sandpaper strips and discs. Silicon dioxide is found in Profi paste, and pumice is a volcanic silica. It can be found in a loose abrasive. It can be in a flour of pumice, which takes those abrasives and pulverizes it even finer to literally look like flour, which is extremely fine and is a major component of Profi paste. Pumice is used to polish teeth, also for dental amalgams and acrylics. Rouge is an iron oxide that's frequently found in a block form. You would take the block and run that onto a rag wheel to polish precious and also semi-precious metals. Tin oxide is an extremely fine abrasive used as a final polishing agent for enamel and other restorations. Tin oxide comes as a powder and is used in a slurry mixed with water. Calcium carbonate is also known as chalk, is also found in Profi paste and in toothpaste. Calcium carbonate is used to polish teeth. It's used to polish metal restorations and plastic materials. Tripoli stone is a mild abrasive found in a block form. Tripoli is used to polish crowns with a rag wheel and also can be incorporated on bristle brushes to polish metals as well. The benefits of a properly finished and polished restoration is that it has decreased retention of biofilm, plaque, and calculus onto its surface. It is higher in resistance to tarnish and corrosion because of, again, the decreased biofilm retention. There is an increased longevity of the restoration. There is decreased attrition of natural tooth surfaces during chewing if it's finished and polished well. Improved aesthetics because there's no margin for stains and food particles and plaque and calculus to adhere to, and improved health of surrounding tissues. No places for plaque, calculus, and bacteria to live and thrive. To finish and polish, we need to remember the margination and removal of flash. In this procedure, this is the removal of excessive restorative material from the margins of the restoration. We don't want the explorer to click or clack over the line where the filling meets the tooth. The clinician must remove these prematurities to bring the restoration flush with the cavity surface of the tooth structure. This could be removed, removing the flash to the removal of an overhang, all as encompassed in this procedure of margination. This procedure is done by using interproximal carvers, blacks, gold knife, a scaler, some types of files. It can be rotary instruments or burrs. Amalgam restorations should not be polished sooner than 24 hours after they're placed. So we need that full 24 hours to set and the mercury to kind of go away before we begin to do any polishing on these. Rotary cut Rotary cutting diamonds and carbide burrs are used to reduce excess material at the cable surface margin. And remember, care must be taken whenever rotary instruments are used for the generation of excessive heat and aerosols. So make sure we have, again, a water source to cool the tooth. This figure shows a polished amalgam and an unpolished amalgam. So the B is unpolished. You can see that's kind of pitted. A is nice and shiny and has been polished previously. For composite restorations, make sure you're finishing polishing these in these 3 steps. The marginal and occlusal excesses are removed in the initial finishing with diamonds or multi-fluted carbide burrs or those finishing burrs. Intermediate finishing is accomplished with flexible discs, cups, and strips, beginning with the coarse types and then going to a superfine material. Final polishing is accomplished with a sub-micron aluminum oxide-based paste applied with soft cups or felt pads. Gold alloys should be finished and polished in the dental lab by a burla wheel and then rouge on a rag wheel. It's important not to leave scratches on the surface prior to cementation so that, again, we don't have a place for biofilm to adhere. Ceramics are finished and polished again in the dental lab. They are polished with rubber points, wheels, diamonds, and a polishing paste. During coronal polish, we need to identify restorations to make sure that we are able to polish them and not create uneven scratches and gouges into those restorations, and choose, again, the most appropriate polishing or cleansing agent that's appropriate for that particular patient. For the resin and cement interface, these margins on resin-bonded ceramic restorations are more susceptible to stain, so we need to pay close attention to those to get them clean. Make sure that there's not a ledge on the edge of that margin, but also to take care not to scratch the natural tooth structure. For implants, clinicians must be careful not to abrade the surface integrity of the titanium implant. There are special plastic instruments that are used to clean implants using tin oxide, a non-abrasive prophy paste, and also plastic sheaths where ultrasonic scalers can be used to remove the biofilm, and for air polishing is not something we want to use on implants. A microabrasion is also called an air polishing machine. They are less abrasive than traditional prophy pastes, and this is a picture of one of those types of machines that can do a Cavitron ultrasonic scale or the air abrasion. Microabrasion are used for chairside cleaning of cast appliances before they're cemented. They can use compressed air and aluminum oxide powder. They can have, or they can remove minimal amounts of tooth and restorative structure upon usage. They are not recommended for stain removal intraorally, and it is critical that you, the clinician, and the patient safety issues are taken into consideration. It creates a lot of aerosol, and you must use HVEs when these are used in the office. Air polishing units such as a ProphyJet is a little different. These use air, sodium bicarbonate or baking powder, and water at a pressure of approximately 40 psi as a means to remove stains and soft deposits from patients' teeth. It's critical, again, that the clinician and patient safety issues are in your mind. Have to use your HVE. Use caution near certain restorations, particularly composites and porcelain, and unexposed dentin and cementum because they can be abraded by the abrasion unit. Infection control, keep in mind that aerosols are definitely created during the use of these units. You need to have your PPE on all the time with these, your gown, mask, safety glasses, and a shield. For toothbrushes, use natural or nylon toothbrush bristles. Nylon is preferred. Bristles are rounded and polished, which makes the toothbrush safer.